Arthritis and osteoarthritis are common conditions that affect the joints, causing pain and discomfort. Arthritis, as a general term, encompasses over 100 different types of joint diseases, leading to symptoms such as joint swelling, stiffness, redness, and a decreased range of motion. Osteoarthritis, a subset of arthritis, specifically refers to the wear and tear of joint cartilage, resulting in symptoms like deep aching pain, tenderness, and sometimes joint grating. While treatment varies depending on the type and severity, it can range from pain management and physical therapy to surgical options such as joint replacement. Risk factors for developing these conditions include age, genetics, previous joint injuries, and obesity, among others. Here's a dive into the detailed aspects of these joint-affecting diseases. Etiological factors, infectious agents versus irritants. Arthritis broadly refers to the inflammation of joints, causing pain and stiffness that typically worsens with age. It can be triggered by various infectious agents like bacteria or viruses, leading to an immune response attacking joint tissues, a condition known as infectious or septic arthritis. Conversely, osteoarthritis, OA, is predominantly a degenerative disease, not driven by pathogens but resulting from wear and tear of cartilage, the hard, slippery tissue that covers the ends of bones where they form a joint. Factors like age, obesity, joint injury, genetics, and overuse can irritate the joints and exacerbate cartilage breakdown in OA, setting it apart from the infection-induced inflammation observed in other forms of arthritis. Understanding these etiological differences is crucial for accurate diagnosis and effective treatment, as managing an infectious agent would be different from addressing the mechanical deterioration seen in osteoarthritis. Site of infection, alveoli versus bronchial tubes. Arthritis and osteoarthritis, while related, affect the joints differently. Arthritis is a general term encompassing joint diseases causing inflammation, stiffness, and pain, potentially affecting multiple body parts, such as the immune system in rheumatoid arthritis. Osteoarthritis, a subtype, results from the wear and tear of joint cartilage, primarily affecting weight-bearing joints like the knees and hips, as well as the hands. In contrast, when discussing infection sites like the alveoli versus the bronchial tubes, it concerns diseases like pneumonia and bronchitis, respectively. Pneumonia leads to the inflammation of the alveoli in the lungs, potentially causing them to fill with fluid, while bronchitis involves inflammation of the bronchial tubes, resulting in cough and mucus production. Recognizing these distinctions is crucial for accurate diagnosis and treatment. Symptom duration, weeks to months versus days to weeks. In distinguishing between arthritis and osteoarthritis, the time frame of symptom manifestation is crucial. Arthritis, a broad term encompassing over 100 types including rheumatoid arthritis, RA, often presents its symptoms over weeks to months. RA, an autoimmune condition, gradually escalates as the immune system mistakenly attacks joint tissues, leading to chronic inflammation. On the contrary, osteoarthritis, a specific form characterized by the wear and tear of joint cartilage, tends to develop symptoms over a longer period, typically years. However, the noticeable discomfort and decreased range of motion may become apparent within days to weeks as mechanical stresses accumulate and exacerbate joint degradation, particularly after periods of overuse or inactivity. Severity of symptoms, severe versus mild to moderate. Arthritis, an umbrella term for joint inflammation encompassing numerous conditions, often presents with varying degrees of discomfort depending on the specific type. Osteoarthritis, OA, a form of arthritis, typically manifests with mild to moderate symptoms that progress slowly. It arises from the wear and tear of joint cartilage, mainly affecting older adults. Unlike rheumatoid arthritis or other autoimmune forms of arthritis, where symptoms can be severe, involving systemic effects and intense pain, OA's symptoms are often localized to the affected joints. The severity in OA is generally proportional to the level of joint degradation and can intensify during periods of overuse or with weather changes, although it usually lacks the acute inflammatory episodes seen in other arthritic conditions. Associated complications, pleural involvement versus no pleural involvement. Arthritis encompasses numerous joint disorders, while osteoarthritis is a specific degenerative form primarily caused by wear and tear. A hallmark difference between general arthritis, which can include rheumatoid arthritis, RA, and osteoarthritis, relates to physical manifestations beyond the joints. In cases of RA, pleural involvement can occur, leading to complications such as pleurisy, pleural effusion, and even lung nodules. Conversely, osteoarthritis strictly affects the cartilage and adjacent bone, typically sparing the pleura. Therefore, the presence of pleural complications can be a crucial factor in differentiating inflammatory arthritis like RA from the mechanically driven deterioration seen in osteoarthritis.